On the podcast today, we have Tal Raizer. She's the founder and CEO of Plasma Med Spa. From her time in the ER and ICU to her time in orthopedics, Tal has dedicated her life to opening a med spa that focuses on the whole person. She's also a professor for aspiring nurse practitioners. And without further ado, let's get into it. Tal, how are you doing today?
I'm doing well. Thank you for having me.
Nice. So, you just opened your practice a year ago. How are things going?
Yes, a little over a year. It's going well. I think, it takes time to establish your brand, trust with the community, awareness, things like that. But yeah, it's going well. I'm paying my bills, which I heard is good. So,
Oh, yeah. As long as you're paying your bills, you're staying in the game.
yes, exactly.
That's what we all want to do. We all just want to stay in the game.
Exactly. Yes. So,
Um,
yeah, so I'm doing that.
Good, very good. And then, of course, there is a little bit of a transition, right? You start off as someone who is directly serving, I mean, we call them clients. Really, they're all just people, right? And you're serving these people, you're caring for their needs from a medical perspective. And then you transition into this business owner role. How has that been for you?
Tough, and I still struggle with that. I tell people that as a medical professional, you're always taken away from the financial aspect of things, right? You come, you do a consultation, you talk to the patients about medical needs, wants, risks, contraindications, outcomes, right? Aftercare, things like that. But you don't ever really, especially, when I worked in orthopedics or even as an emergency room nurse, you're really separated from the financial aspect of a consultation, right? Like you're not responsible for charging the patient. You are not the one deeming how much the patient is going to be paying, right? Like that's based on insurance numbers and, set fees and stuff like that. And so it's really hard for me as a medical provider to shift into, okay, well, but now it's also a business. This is a cash pay business. And so always in my head, right, are these like alarm bells being like, oh my God, if you tell them the number, they're gonna run away. They're not gonna want to pay you. Maybe you should give them a discount. But at the end of the day, I'm also running a business, and granted, I'm not paying myself, but I have to pay my bills. And so it's taken me a long time to learn like how to talk to people about financial investment, because really it is an investment when we talk about aesthetics, right? It's and kind of navigating that where I don't feel super awkward, and I still feel awkward. So, but it's getting better. So, but yeah, I think we don't really as medical providers get training on that. So, and I don't like saying the word sales training because like I don't feel like I am selling anything. It's more like this is a medical procedure. It costs this much because that's just what it costs. And right, like they're going to be the ones to determine whether or not they want to invest that. So yeah, so I don't really have that training. So yeah, I mean, I don't know. Maybe maybe I should look into some sort of training for that. But yeah, I mean that part is a struggle.
Yeah,
It's a
and
struggle.
you're definitely not alone in facing that. I deal with that myself, and I just think sales, a lot of what people really hate in sales are undelivered promises. I think a lot of
Hmm.
salesmen or saleswomen, they get in, they give you all these promises, and then
Hmm.
when they don't fulfill that, but I think when you remove that, when you remove that bias and you really look at, I am in service of this person. I want to
Hmm.
see them, you know, look better, feel better, become
Hmm.
better.
Hmm.
And, in each of our pre-podcast calls, it's become clear to me, Tal, that you're the kind of person that anyone who steps into your clinic is going to be blessed by your presence.
Oh,
They're going to be
thank
blessed.
you.
And
That's so
so,
kind.
I would just say, be bold, be confident, and, you know, the right people will keep coming. And like you said, it's
Yes.
it's not a cost, it's an investment, right?
Yeah.
And
for sure.
What better thing to invest in than yourself? Sorry, I'm talking too much.
No, no, not at all. I mean, it's aesthetics cost a lot of money, right? Like, and to be honest, and I even tell this to my patients, the reasons that I am able to do aesthetics is because I own this business, right? So like budgets are real. Like I totally understand that. But yeah, it's interesting because, and I'll give you an interesting example actually that happened to me. So when I first opened, I had a patient approach me and they wanted a discount on, I don't even remember what procedure it was. And I have such a hard time, right? Like I'm happy to give discounts, like that's not an issue for me. But when people, right, like, but I always feel like as a person who owns a business, when I go to other business owners to get whatever service, my hair, nails, like physical therapy, whatever it may be, right? Like I would never go and be like, "Hey, can I have a discount?" Like I don't go to the grocery store and I'm like, hey, can I have a discount on this milk? Right. And again, I understand, right? People have limited financial budgets. They want to get the best deal for themselves. I don't think like anyone's trying to be rude, but at the end of the day, right? Like my education is worth something and my business is a business. It's not a charity, right? So at the end of the day, I have to uphold some sort of standard in order to survive, right? Like in order to pay my bills, in order to someday pay myself. And so I was like, you know what? No, I'm not going to give a discount to this person. Um, just because, again, like you have to have some boundary, right? You have to have faith in yourself to say that, right? Because if I give a discount to every person that asks, this is not going to be a business. Like I'm never going to be able to succeed and be able to pay myself, right? So, so the person was like, and I said no, and they're like, okay. So they're like, okay, I'll call you, and then they never did, right? And then a year later, a year, this person called me, came in and did the procedure and did not ask for a discount. And I was like, wow, you know what? Like, we don't always have faith in ourselves. And sometimes we doubt because I was like, could I use this money today to pay my bills? Yes, I definitely could, even with the discount, right? Because sometimes they tell you something is better than nothing, right? And so that mentality sometimes makes you feel like, okay, yeah, I'll give discounts, I'll take whatever I can get just so I can get people in the door. And interestingly enough, when I first hired a marketing company, they were like, well, what if you lower your prices and just like increase your volume? And I was like, I would rather walk away from my business, lose every single dollar that I've spent. And that's hundreds of thousands of dollars, right? I would rather lose all this money than do what you just told me to do. Because then I'm not valuing myself. And how can other people value me if I don't value my time, my education, right? Like, so anyway, I mean, I guess that's just like a little story about how if you have faith in yourself and you set those boundaries, that maybe it will come back. Definitely not every time, but in this one instance, it did.
No, I totally agree. And I think you're right to do that because there's a certain kind of client that always asks for a discount. And then there's a
Hmm.
kind of client that values you. And it's
Yes,
hard to say
it's hard.
it's hard to hold yourself to that standard, but
Yes.
I think your perspective is right on. And I think what you're touching on is really that balance between humility and ambition. And you
Hmm.
need both. You really need both.
Yes.
And, diving more into that, like obviously running a business is a high pressure situation, but you came up through the ER and the
Hmm.
ICU. What experiences from that world shaped the way you run Plasma Med Spa?
Yeah. I mean, so my first job, I went to Johns Hopkins. That was where I went to nursing school. And so my first job out of nursing school, I wanted to work in the ER. That was like my dream. So the job that I got, I did get a job right out of school working in an ER, was for a not-for-profit Catholic hospital run by nuns in the west side of Baltimore. And I don't know how much you know about Baltimore, but the west side is like I mean, just like the worst part of Baltimore. Okay. Like we would have gunshot wound stabbings right in front of our hospital. Like, I mean, we were not a trauma center, but we would get all these traumas because they would get shot or stabbed. Or, I mean, we had SWAT teams in our emergency room. We had armed guards. I mean, like, it was just, that place was insane.
We could do a whole
Um,
episode just about that.
we really could. I mean, the stories. I like, oh God, I mean, I don't know how much time we have, but just some of the things that I saw in that emergency room. But I gotta say, it made me a really good nurse. I cried every day before I went to work. I cried every day when I came home from work. I was just physically, mentally, and psychologically exhausted by everything that happened in there. But you also see a lot, and right, it like changes how you approach people, right? Um, and to have like a lot of empathy, I think, um, for people's situations that we might not know, like what they're going through. And then also like a lot of resilience because you have to have tough skin. I mean, I got called so many names. Just one lady kicked me. I mean, right, like so I was just like verbally and physically abused there. And when I left that job, I went to work in like this very nice, swanky emergency room in Colorado. And it was obviously very different. It was a lot more calm and organized. We had a lot more staffing. And, but I don't know, sometimes you're like, you don't know that it's necessarily better, right? Because I was making such a huge difference, right? At this other place, I was literally treating like these people who had nothing. Um, so sometimes, but again, it made me very resilient, right? Like, so in stressful situations, now I'm just like, well, no one's going to stab me in the parking lot. So everything's cool.
Wow. I know Baltimore from Hairspray, and I didn't see any of that in Hairspray.
Oh, no, no.
I'm thinking Good Morning Baltimore singing on the.
No, like The Wire. I don't know if you've watched The Wire, but
Oh,
that
yeah.
was like where I worked.
Oh my
I'm
gosh.
so thankful for that experience. And I bonded so much with my coworkers because, right, when you're in a
Oh, yeah.
trauma situation,
Trauma
right,
bonding.
yeah, trauma bonding, exactly. So I will forever be thankful because I learned how to be like a very scrappy and resilient and how to make decisions on the fly. And yeah, no, it was a great experience. I'm very lucky.
And something I always think is fascinating about these kind of interviews is you learn different aspects of your experience. And as a writer, that's my background. Before I went into marketing, I was always into writing. And one thing that they tell young writers is they say character drives the story. And what you do when you're writing a story is you figure out who is your character, who are they inside and out. And once you know that, the way that you progress the story is you introduce challenges. And based
Hmm.
on how well you know your character, you know how they'll take on those challenges. And whether I think we all need to believe in something bigger than ourselves, whether that's God or the universe or just a higher power. But I can definitely see in your story how you are facing these challenges and you're overcoming these challenges. And from the ER and ICU in Baltimore, you learn something. And then you learn something in Colorado that maybe feels more like the med spa that you run now.
Sure.
But as you go, you're growing and developing. And that's something I think is really interesting about you as well, is that your focus is on not only treating aesthetics or not only treating, the medical side, but really a med spa focused on servicing the whole person. So what does
Mhm.
that look like in practice, and how does it differ from maybe the standard med spa model?
Yeah, I mean, I think, and it's probably also because this is something, right? They say you have to practice what you preach. So it is something that I feel not obligated, but maybe like right, like as you mentioned, I'm a professor, so I like to teach. And so that's something that I feel very strongly about in my consultations, right? Like, for example, I did a consultation today for a patient that has never had any sort of aesthetic work at all, ever. And she really wanted to start that. And the amount of times that I said this is a journey, right? It's not like a one-stop shop. And I always equate it to brushing your teeth. I always tell people, well, you don't brush your teeth one day and your teeth are clean, right? It's the same with aesthetics. And so, it's something that I feel like I have to educate my patients on about not just aesthetics, but in a sense, right? Like if you're a smoker, right? Like, or you have uncontrolled diabetes, right? I mean, yes, you could put filler and Botox in your face, but like, what is that doing to your overall health. And actually, I did another podcast interview where they really asked me questions about how aesthetics kind of fits into wellness. And I really think that aesthetics is a big part of wellness. There are so many studies that show that aesthetics, or I guess self-confidence levels, right, help with depression, anxiety, confidence and performance in your job. And, these are things that sometimes may seem to other people as vanity, but I don't think that's true. There's a lot of power in feeling confident in your own body and your own skin. And so I think that also taking some of the stigma out of it, right? Like saying, okay, yeah, society puts pressure, especially on women, but men too, to look a certain way. But it's okay for us to want to look that way, right? Because I always say that, for example, right, like we're like, oh, women should be beautiful and smile and whatever, but then like we judge them for wanting to be beautiful. Right. So, I mean, I just like that dichotomy really like plays a lot in my mind. And I think that comes through in like how I educate my patients on exercise, hydration, making sure that they're controlling any comorbidities that they might have, and then referring them out for, functional medicine or other doctors that might be helpful in taking care of their overall wellness. So yeah, that's really how it looks like for me.
Yeah, I really like that. And I like your plug on, this is more than vanity. This is
Mhm.
and I even wrote this down, like it's a vehicle for confidence, overcoming anxiety. And really that
Mhm.
there is a power in feeling good in your own skin that is,
Yes.
I'm sure it's medically measurable.
Oh, for sure. I mean, and I'll say even for myself, again, like one of the things that I think is really important is transparency, right? Because a lot of people, and again, people for whatever reason don't want to share that they've had any aesthetics done or they used medical weight loss or whatever it may be, right? And I understand that. But for me, I am very transparent about what I do because it's also psychologically, right? Patients need to know, okay, well, she wasn't born like that, right? Like I'm not just like naturally anti-aging my face, right? Like it's not because I drink salt water and lemon, right? So which I don't. But so, and I always say that because I took the GLP-1s for weight loss for the last like 2 years, like on and off, and I lost almost 30 pounds. I was an athlete when I was in high school. I trained for half marathons with my husband, who's a runner. I lifted weights. Like I was always like exercise was always part of my life, but I was never like skinny. And I just say that as an example for myself because like when I took these medications, I finally felt comfortable in my own skin and the power that that gives you, not only physically confidence wise, but also psychologically, right? To just like go and be present in a place where you don't feel self conscious. That's so powerful. So I definitely think that's a huge part of wellness.
I also just want to say, I love that you mentioned your husband because I did have your husband on the podcast.
Yes.
He was my very first guest. And the fact that I
Yes.
met you separately has been so wild. Another thing
Yes.
that I love that just demonstrates that you are aspirational in all aspects is that when I had Sean on, he mentioned you. And when I had you on, you mentioned him. And I didn't
Yes.
necessarily specifically ask those questions. But I
Sure.
love that you're both mentioning each other because it shows you guys are a power couple. You rely on each other. And I think that's so important in starting a business. You need that support.
Oh,
Um,
yes. I mean, I would have never done this if it wasn't for him because he's the one who, and I think we talked about it a little bit during the pre-interview, but right, like owning your own business is like, just the psychological aspect of it, right? Like one day feeling like you're doing amazing and the next day being like, no, I want to quit. Like I don't want to do this anymore. And the next day crying, right? But throughout this whole thing, I mean, he's the reason that I keep going because he's like, you're doing, he's so encouraging and he believes in me. And, even though I believe in myself, right, there are always moments of doubt. And so having, that support is really important.
Absolutely. And that really brings me to my final question, which is, you have this great foundation for starting this business. I know you're earlier on in your journey, But what would you say to someone looking to open a med spa who may feel daunted by the challenge of it all?
Yeah, I mean, there are tips that I would give for success in the sense of logistical, right? And then there are tips that I would give for psychological. So logistically, I would say start small, keep your overhead super low, like rent a salon suite. I did a whole build out on a space. I would never do that again. That was terrible. Um, and expensive, and takes a long time. So rent a salon suite, build your client base, keep your overhead as low as possible. And then also find a network, people who will support you. You know, I have a lot of good friends who are in the aesthetics industry, one of which trained me and did it out of the goodness out of her own heart when she didn't even know me. So finding people who are supportive rather than want to take you down, that's super important because at the end of the day, even though I'm trained to do what I do, like I don't know everything. So if I always need people to reach out to, if God forbid something happens, or, if the self-doubt kicks in, right? Like you want to know that there are other people who do what you do and who will support you. And then the other thing I would say, yeah, having, a good support system at home that when you decide that, you're making a mistake, that they're going to be there to let you know that you should keep going. Now, a few people have told me that if you wake up every day, work really hard, and continue to do that, that your business will succeed. So I'm definitely banking on that because there are a lot of times where I'm like, oh my God, what am I doing? Why did I do this? Like, shouldn't I just go get a full-time job where I make six figures and I don't have to worry about this? But I really enjoy what I do. So that's also part of it. I think that comes out in how, you run your business. And then just being like really genuine with people that has, again, that's something that I pride myself on. And so I think people feel that, your patients feel that, the community feels that, when I make business partnerships and stuff like that. And that's not something you can really learn, but it is something that I think people should try to do.
Well, I genuinely enjoyed this conversation and really appreciate all
Thank
of your
you.
insight. I hope
Of
anyone
course.
watching can apply these principles and grow, right?
Yes, that's the hope.
Thank you so much, Tal.
Thank you.